Hi, Dr. Bhaumik.
Hello, ma'am.
It's been a real pleasure to have you today in this talk show because, we all know that, mental stress is a very common topic that has been discussed these days, more so from COVID and post COVID, right? The world is changing really fast, and to be able to cope with the changing world and keeping pace, I see that it's a big topic where uh, around 24% of India's population is being impacted with mental stress. And you being an MD in psychiatry, I would really want to hear from you, Dr. Bhaumik. What is your take in terms of the mental stress? What are the causes typically, that brings in mental stress to start with?
Yes, ma'am. Thank you for introducing me, ma'am. I've been working in the field since 2018, and I've been a doctor since 2016. So I have been exposed to a lot of people who have been, victims or have suffered from whether consequences of mental stress. Sometimes when it becomes too much, and it becomes a clinical syndrome, it becomes a disorder. So we do have, you know, various ways of categorizing how much of stress we are dealing with. And once we do that, we also try to understand what are the predisposing causes, what are the precipitating factors, what are the factors which are continuing the stress in their life. So what we see is usually broadly we can categorize them into biological factors, social factors, and psychological factors. So when I say biological factor, what I mean is a strong family history. So a lot of illnesses like depression or bipolar disorder, they have a heavy genetic loading. By that I mean that if the father or the mother has bipolar disorder, then there is almost a 50% chance of the children having bipolar disorder. So that is the first category which we call biological. The second one is social factors. So, for example, if you're growing up in a very traumatic environment where there's a lot of chaos in the family during the years where you're growing up, or even you have bad influences either at school or in college, and they don't really show you the right way. Uh, these are the factors which contribute to the progression of a depressive disorder or a mental illness. And finally, we have psychological factors, by which we mean that certain individuals are predisposed to, altered ways of thinking, which in our language we call cognitive distortions. So, if I'm driving down the road and there's a car that is zooming by, passing me by without a horn or an indication, my reaction to that would depend on what kind of a day I'm having. So we would think that, oh, okay, I'm slow and this guy's really fast, and maybe I'm being a nuisance on the road. So thinking like this is what we call black and white thinking, or all or none thinking, by which we mean that we either take two extremes of a certain situation. That either we are very good or we are very bad, and a lot of us actually falter in understanding that a lot of us are basically in the middle, where you know on the same day we might be facing some situations where we are a little bad or a little good, but
Hmm.
most of us aren't very bad or very good. And that's why self blame and perceptions about oneself or others also contributes to how a mental illness develops.
Okay. So, typically, what is the age group, that you get your patients and, and they belong to which professions usually?
Okay, so that would depend on where I'm practicing. So in the urban setup, when I was in my days in Bangalore, when I practiced in Calcutta, I see a lot of working individuals who has their 9 to 5 jobs, and a lot of stress from work where they're trying to meet their deadlines, um, where they are really stressed out. And I feel that that is not the only causing factor. I find a lot of people are caught up in jobs which they don't particularly enjoy. And when you don't enjoy your work, you often struggle to meet those deadlines because you're not enjoying the work in the first place. So I feel that because of certain situation, maybe it's a financial situation, maybe it's they're trying to support the family, or there's some bindings elsewhere, which is why they are caught up in these jobs, which is where I feel, urban India, especially in the faster cities like Bangalore and Bombay, a lot of people are dealing with a lot of workplace related stress. Uh, but apart from that, I would say throughout India there is a lot of problems with occurring within the home. For example, how the husband is treating the wife, what kind of behavior the children are being exposed to while they're growing up. Are they having a proper role models? Are they looking up to their father? Are they looking up to their mother? And while they're growing up, are they attributing or alluding to the right values while growing up? So I think these are where a lot of contributions happen. So so basically, in rural India and in general throughout India, there's a lot of problems with domestic violence and addiction, while in urban India, it's mostly about workplace stress.
Okay. So, I mean, as a psychiatrist, what is your mode of treatment? I mean, is it a short term or is it a long term kind of a treatment that you offer to your patients?
Yes, ma'am. So again, that would actually depend on what kind of a patient we're dealing with. But uh, broadly, we can say that if we are dealing with a psychotic illness or a depressive illness, uh, or addiction, we usually try to split that up into acute management and maintenance, that is chronic management. So, for example, I'll give an example. If a person is addicted to alcohol, they usually come to us not when they're drinking, but when they're withdrawing, because that's when they have the physical symptoms. That's when they have their, the hands start shaking, they have tremors, they suddenly feel nauseous, they have a lot of, internal and anxiety and agitation, which is when they seek help. So that during that time, it is not really our job to scold them or to judge them or tell them, why are you doing this and why are you affecting your family. Our job is to actually provide them relief, so that that particular day when they're having that amount of stress and something that is being intolerable to them, and we as doctors can help them out. So we try to treat the withdrawal over a space of 4 to 5 days, and once the patient settles down, then we try to counsel them with the help of some what we call motivation enhancement, where we try to work on the factors that are preventing them from stopping the use of alcohol. So a lot of people are just thinking about quitting but never really progressing to taking that step. A lot of people are prepared in their minds to take that step but are not getting the professional help or the expertise to carry that out. So we are trying to understand what stage of their thinking process are they in, and help them in their journey towards prevention of a relapse. So we basically treat the withdrawal first, and in the second stage we treat abstinence, and we help them to stay abstinent with the help of both pharmacology, that is medicines, as well as some counseling.
Okay. So, yeah, I mean, coming back to your patients who are from the urban India, right? I mean, when will someone know that they need help from a psychiatrist? Usually, people will be in a denial mode, right? Even if they go through a stress,
Yes, ma'am.
they will try to get it, they will try to solve it by themselves, but probably that is not the best way, and they need that help and counseling. So, typically,
Hmm.
what would be your advice?
Yes. So I think a lot of us would be trying to do that. I mean, I think you or me, whenever we are facing a stressful situation, first we try to solve it ourselves in our heads, if we can do something by ourselves to solve it. But there comes a point where uh, it becomes unmanageable, especially when, according to my experience, when the support system around you is not that great, especially you cannot really share your conflicts with your parents maybe, or with your siblings, or with your partner. That's when it becomes difficult to contain all these emotions inside of you. So as a doctor, I try to pick up signs such as irritability, or changes in their mood, or is the person, crying suddenly, or sometimes when it progresses, they might talk about something strange which we might not have heard before. So, like a perfectly happy person might be talking about ending their life or suicide. So when there's a drastic change in the personality, is when we become really alarmed, and that's when our siren bells start ringing that this patient needs to be taken seriously, and we kind of say that okay, this patient needs help or needs admission, they need some surveillance and some monitoring till again they get back to their normal self. So the way I say it, I usually split it up into three groups. I say there are some cognitive symptoms in the sense that you're facing a difficulty with attention or carrying out your daily activities. Then I say there are some physiological symptoms, which means that you're having some problem with your body. You suddenly feel palpitations in your chest. Your hands might start trembling, uh, or you might be sweating. And finally, there might be some physiological, mental, and behavioral symptoms, right? So, for example, you're suddenly becoming very irritable. You might be having a very cordial relationship with your mother, but suddenly you might be shouting at her at the dinner table. You might be suddenly saying, that life is not worth living, and you might be becoming very agitated in between. So, if we see that, if there are any cognitive symptoms or physiological symptoms or behavioral symptoms, we kind of say that this patient or this person needs help. So this is something that everybody should know, because it's not just the doctors or the medical
Right.
fraternity's job to pick up things, and everybody in the society, at the office, in the family should be at the lookout for these kind of symptoms.
Okay. And one last question for today is, how do you think AI could help you as a doctor to
Right,
identify mental illness in your patients in a more productive
right,
way?
right. So that's a very relevant question, because mental health is actually progressing towards a lot of science that is being used. So we do use AI in the form of machine learning to understand the networks in the brain. So, for example, when we're looking at the world outside, there's a separate network in the brain that's working. When we are thinking about ourselves, in an introspective mode, there's a separate network in the brain that's working, right? So, and there's another network which keeps the balance between these two networks, and these are known by different names. And the very basis of how these networks are found was with the help of machine learning, which is basically a mode of artificial intelligence. So a lot of work has been done by the NIMH, which is the mental health organization in the United States, which are basically trying to figure out that what are the tracks or the pathways in the brain by which these things are happening, and how they can be helped. So they're basically trying to zero in so that we can help the individuals a lot better with some targeted therapy.
Perfect. So I think that was a very great session to hear from you, Dr. Bhaumik. And I'm sure, in the upcoming days and months and years, probably, we both can work together to create an impact on society and, improve the mental well-being of people around us. And thank you so
Yes,
much.
ma'am.
Have a great
Yes,
evening
ma'am.
ahead today.
Thank you, ma'am. On a last note, I would just like to say that there's a lot of stigma, and people usually prefer to go to physicians or any other doctor like a surgeon or a neurosurgeon, but not come to a mental health specialist. But that really does not help, because you need to go to the person who has the specialist training and the perfect training to help you out. They'll understand the stage at which your illness is in. They'll understand what kind of expert help you need, and what stage of the illness needs what kind of intervention. So just a small request to everybody to not hesitate to visit a mental health expert or a psychiatrist or a psychologist, because that gives you the best chance at recovery. Thank you.
Right, right. Yeah, I think you hit the nail on the head. And yeah, absolutely. Yeah, that's
Yes,
very,
ma'am.
very critical and important. And thank you once again, Dr. Bhaumik. Thank you for your time.
Yes, ma'am. Thank you, ma'am.